Dr. Bill Burman. I'm the Director of Public Health at Denver Health. I think it's mixed. Cases have come way down from where they were back in late November, but they're still relatively high. And we've had a modest, thus far, post-winter holiday bump. I'm hopeful that that's going to even out and start to decrease again, because there are metrics that look like they're headed in that direction. So for example, percent positivity, both locally and at the state, is decreasing. Hospitalizations are not increasing. That's a good sign. And emergency department visits for COVID-like symptoms are not increasing. So my overall sense is we've had a post-winter holiday surge. I think it's going to be modest, and I'm hopeful that it's going to start to decrease. You know, we've learned during the COVID epidemic a lot, and particularly in this case about schools and COVID. And I think the critical piece that we learned over the fall was that schools can be safe places even when community case rates are relatively high. And by safe places, I mean a very low risk of being infected with COVID while at school. There's also another point, which is that other viruses that commonly interfere with school during the winter months, influenza and norovirus, are also very low right now. And we think that's because the same set of basic prevention measures that prevent COVID also prevent influenza and probably norovirus. So that's the idea, is that school, if we do the basics right, school can be a safe place even when community transmission is active. The second part is symptom screening and then rapid evaluation of those with symptoms. That's what we've developed with the school-based health centers, is the ability to test kids quickly when they have symptoms so we can determine if they have COVID, manage that appropriately, and importantly, if they don't, get them back to school as soon as possible. So second key piece. The third piece is distancing. And sometimes people want a magic number. What's the magic number for distancing? And what I say is it depends on the situation. There isn't a single distance that is always safe and below which it's not safe. It depends on what the situation is. We, with DPS, try to have at least 3 feet of distancing and then 6 feet if possible. And then attention to ventilation, and I know a lot of work's been done with DPS schools to improve ventilation. And then it's avoiding crowds. How can we move things outside to the extent they can be, and minimize mixing between groups? So those are the basics. If we do them well, school can be a safe place right now. So right now we're working with DPS to get healthcare staff at DPS vaccinated. And so that's happening this week through a partnership with Children's Hospital Colorado. By the governor's plan, the rest of school staff fall in the category of what's called essential workers. And essential workers are to be vaccinated after we've completed or made substantial progress, is a better way to say it, with persons who are 70 years of age and older. And this past week, the governor gave us a definition for what he wanted us to accomplish with those 70 years and older, and that's to vaccinate 70% of those individuals. And then we can go on to quote essential workers, which includes other school staff. The state estimates that could be in late February or March. So that's the current timeline. What I can say is that we're working with DPS to have all the preparations made so that when the opportunity comes, when the governor says it's time to vaccinate essential workers, the DPS staff can be vaccinated as quickly as possible. So there's a lot of concern, and very appropriately so, about this variant that's been common in the United Kingdom. So we'll just call it the United Kingdom variant. It has a technical name, but that's probably a better name for it. That's become widespread in the United Kingdom and appears to be contributing to the rapid rise in cases there. So it's certainly a concerning variant of COVID. It's occurred in Colorado. There have now been 3 cases. But it appears to be quite uncommon now, so well under 1%. It's being monitored very closely by the state health lab and other labs So I think we'll know if it's starting to increase. That's good to know. The key things to know about the variant are that it doesn't change the basics. If anything, it just makes the basics that much more important. So no new messages, just increasingly important that we follow the basics. It is picked up by standard tests, so that's also helpful to know. We're not missing it with the tests that we're using. And finally, there's more work that needs to be done, but the early results from immunology is that the vaccine is very likely to be fully active against this strain. So it's certainly a concern. We're watching it closely, but it remains uncommon and it doesn't change our basic messages.